Hey Brainwaves listeners, a few quick updates before we get into the show. First, this episode of the Brainwaves podcast is going to be the last weekly episode for a while. I'm taking on a new job next week and I need to scale back a bit on the program. Shows will continue to run every 2 weeks, the first and the third Thursday of the month, from July 2018 onward, so keep your Brainwaves subscriptions active. Second, we'll be scaling back on the website too. I've gotten a lot of useful feedback from listeners over the roughly 2.5 years that we've had the show going. I mean, come on, this is the 114th official show since it began in March 2016. Most people have told me that they listen to the show in the car, on the way to work, or if they're at the gym, or on a run or something. Very few people say that they actually listen to the show and check out the blog entry as well. Online traffic is kind of low, and it takes a lot of time and money to keep it going. So we're going to be phasing out the website over the next 6 to 12 months. Third, although it seems like I'm starting to peel back all the efforts to keep the show going, the fact of the matter is that I just built a new studio for recording future shows. New soundproofing, better recording gear, mic shields, and a way more comfortable setup. It's the third studio that I've used for Brainwaves recordings, so I'm properly titling it Studio 3. Hopefully with this new recording setup, I'll finally be able to match the quality of the audio with the quality of the content. The last thing, item number 4, I'm sick of commercials. So we're just going to get rid of them. Except for this one. This is the last one. And then we'll get into the show. A lot of training programs don't teach you how to bill properly. It's something that nobody wants to think about. Whether a patient should be billed at a level 3 or 4 or 5, the difference might be as small as documenting your own interpretation of an MRI, but there could be more than a twofold difference in payment. There's an app called BillUp, which takes the thinking out of billing, and I use it when I'm closing notes, and in a few taps I can calculate the best level of service, or make sure my note has enough documented. Just search the App Store for BillUp. BillUp, so you can focus on patient care. Hey podcast listeners, Jim Sigler here from Studio 3 in Philadelphia. So I'm part of this local neighborhood listserv, probably has 50 or 60 families on it. Just like any local group, I get an email every week or two with some kind of update. Somebody's concerned with the broken down street sign not being replaced by the city. Someone planning on a barbecue for the 4th of July, or somebody upset about the mail being late. And then, the other day, I get an email like this. Our driver's side window was smashed on Sunday night. There was no greeting, she just jumped right into it. Our driver's side window was smashed in on Sunday night. And again last night. Yes, the new window. Nothing was taken. Once parked on 24th Street, and the second time on Walnut. New paragraph. Rocky Raccoon was spotted on Monday at 4 a.m. climbing the fence into the yard. I bleeped the name in order to protect the identity of the family whose home was invaded by Rocky the Raccoon. Back to the email. I'm told if they're out in daylight, they usually are rabid, so please beware. They are usually rabid, so please beware. By usually, did the author of this email mean commonly? As in, more likely than not? If I saw a raccoon on the way home from work tomorrow, would that mean the raccoon was more likely to be rabid than healthy? And what did she mean by rabid? Did she mean infected with the rabies virus? Or did she just mean aggressive and pesky? A wild city animal that rummages through your trash cans, sifting through your leftovers. I mean, to my understanding, rabies is a fatal disease, and we do see a good number of raccoons in urban Philadelphia, so I found it hard to believe that there's some sort of rabies epidemic going on involving local raccoons. As rabies is a neurologic diagnosis, I was curious to know about how common rabies is among city animals, and if there was a reason that I should actually be concerned from this email. More concerned than just it's a typical wild animal bite and developing an infection from the skin and mouth flora. And as I pursued the answer to this question, I quickly learned that the subtext in my neighbor's email, that footnote, they are usually rabid, so please beware, was really a flaccid warning. It was pathetic. That one sentence does not do this disease enough justice. Welcome back to Brainwaves. Today on the show, zombies. And by zombies, I really mean rabies. We talked about zombies back in October last year with Brian Hanrahan, and that was an amazing show. But this week, it's just rabies. which is the more horrifying and the real-world zombie scenario. And we'll get to it in a minute. Don't go anywhere. Madness. That's the name that the Greeks gave to it. Anyone who was afflicted with what was likely rabies was said to have lyssa, or litta, which roughly translates to madness. The current name for it, rabies, is actually derived from the Sanskrit word rabhas, which means to do violence. Some of the more thorough descriptions of the disease were published 500 years before the Common Era, including one book by Aristotle, Natural History of Animals. Even then, it was known that the disease could be transmitted from dog to dog by means of a bite, and then all dogs would, quote, suffer from madness, as it was described. But Aristotle didn't know, or at least he didn't acknowledge, that rabies could be transmitted from a dog to a human. Hippocrates, on the other hand, our father of medicine, was one of the few early minds who reached that startling conclusion about 100 years later. And among his other accomplishments, Hippocrates described the characteristic hydrophobia, or fear of water, that would define the affliction, and he would also summarize other symptoms of this frenzy, including convulsions. It was a surprisingly common problem, both among dogs and humans, throughout antiquity. Rabies was described by almost all of the great physicians and scholars throughout history. Celsus, who recommended burning, cupping, or sucking the wound of a dog bite in Rome in the early 1st century. Virgil, the poet, described rabies as the pestilence of the air. Galen, 2nd century. Rhazes in the 9th century, who's also credited for some of the better descriptions of smallpox and measles. Avicenna in the 11th century, who, like Rhazes, was an Arabic physician, and so on. Rabies was probably brought to the U.S. by European colonists, and here, right here in my city of Philadelphia, it was a major problem. Just as American revolutionaries began patting themselves on the back after teaming up with France in 1778, rabies becomes a major disturbance throughout much of the mid-Atlantic and the Northeast, and it continued to scourge the local dogs, wolves, foxes, farm animals, and yeah, humans. By 1785, states like New York, Connecticut, and New Hampshire even enacted laws to reduce the stray dog population, usually involving confinement, but sometimes using lethal force. Dogs also had become taxable property. You had to pay the state to keep your cuddly companion in some places. A decade later, London passed similar measures in response to a smaller outbreak earlier that year, 6 or so infected people who likely died of the disease. Despite dog taxes and attempts at reducing the population of strays, the incidence of new animal and human infections would only grow in the early 19th century. By the 1880s, veterinarian Dr. Frank Billings concluded from his investigations into the matter that 50% of humans in that century who were bitten by dogs would actually acquire the disease. And this was all a piece of the story that I don't think I ever heard in my high school U.S. history class. There was even an entire 200-page dissertation on this by John Douglas Blaisdell in 1995 if you care to read more about it, and you can find the link to this on our blog. While I'm making it seem like there were just packs of stray dogs or entire herds of cattle infected with the rabies throughout history, and especially in the late 18th century post-revolutionary America, it wasn't exceedingly common. It was something to worry about, for sure, with an incidence that was on par with the recent E. coli outbreak from lettuce just this past April.
46 people, more than half of those who've been infected, have had to go to the hospital, including 10 people with kidney failure. Health officials say
most people probably didn't report contracting the madness, just like I'm sure most people didn't report developing an upset stomach after eating contaminated lettuce from Yuma. But America was in a state of panic at the thought of the E. coli outbreak because it can cause hemolytic uremic syndrome in a few infected patients. And one patient died as of May 5th, 2018. Lettuce was stricken from the shelves of nearly all grocery stores, and when I tried to order Chipotle on the way into the hospital for a night shift, was there any lettuce for my carnitas salad? No way. Imagine the hysteria if news spread as easily back then as it does now. When instead of one farm in Arizona raising a crop of potentially infectious lettuce, and there being only one death associated with it, back in post-colonial America, rabies was everywhere, and dozens of people died from it every year. In New York City alone, there were as many as 3 deaths every year from the disease. The local news ate it up. Headlines read, A Struggle with a Mad Dog, Miss Burnt's Awkward Position and How She Escaped, 1884. A Mad Dog Bites 16 Persons, 1894. Mad Dog at a Ball, appears at a college student's dance and bites 3 men, 1900. Big Mad Dog blocks traffic, turns up its nose at sausage but bites boy and policeman, and finally is shot, 1901. There are tons of headlines just like this. The history of rabies is actually incredibly fascinating, and like much of medicine, humans really had no idea what was going on until the era of modern medicine. Up until the mid-19th century, one leading theory as to the transmissibility of the madness was that a worm had implanted itself into the tongues of affected canines, and removal of that particular fold of the tongue could prevent transmission.
Rabies is the scariest part of my job.
This is Dr. Krista Rieckert, who joined me on the show via Skype.
My name's Dr. Krista Rieckert. I'm a veterinarian in Baltimore, Maryland.
She currently works at Eastern Animal Hospital there.
In any given day, I can see 20 animals.
How commonly do you get a consult for rabies?
So usually when we're getting appointments for checking for rabies, it's in situations where a cat or a dog has bit a person and that cat or dog is not vaccinated. I see one every few months. It's not all that common. And that is separate from when we actually do see rabies. That is usually more of an emergency type situation, or a pet makes a sick visit, but that's a little more rare. A lot of other times it's, someone finds a stray and brings it into the emergency room. And when they come in neurologic, we just have to be very cautious and always have rabies on the differential list.
Other conditions that vets include in their differential is a purely inflammatory encephalitis.
We call it GME in dogs.
Granulomatous meningoencephalitis.
That is usually a sterile inflammation.
It's kind of like the dog equivalent to human IgG4 disease or neurosarcoidosis.
With cats, it's usually infectious, something like toxoplasmosis or fungal diseases. Dogs can get certain kinds of tick diseases, distemper virus, and then cats can also get something called FIP that can cause neurologic signs.
Feline infectious peritonitis, which can cause buildup of fluid in the abdominal organs, but also neurologic symptoms like what we see in rabies, behavior changes, ataxia, and eventually paralysis. So why do we need to know about this, Jim? Who cares? Well, you've probably heard of dengue, maybe yellow fever, Japanese encephalitis. Rabies kills more humans in the world every year than all 3 of those diseases combined. Mortality after an untreated rabies exposure may be 40 to 60%, and probably even higher for other rabid species like wolves. And while the patient's history is often totally obvious, I was out mowing the lawn and I was bitten by this crazy squirrel, the symptomatology is complex and it can confuse you. So you should be able to recognize it and have a low threshold to consider it in your differential diagnosis as a healthcare provider. And as a patient who suffers a bite from some wild animal, you should always go to the emergency room. In the clinic or the ER as a doctor, you might not get that classic history of, I was spelunking last month and my boyfriend noticed 2 red dots on my shoulder. Could they have been from a bat bite? You may also not hear of an animal exposure at all, but that means nothing if the patient may have traveled to a rabies endemic region where exposures are common and they're frequently ignored. It's known among neurovirologists that the rabies virus has the most variable duration of an incubation period, ranging from 2 weeks to 6 months before central nervous system manifestations even appear. Once inoculated, a viral glycoprotein binds to the nicotinic acetylcholine and other receptors of the neuromuscular junction. It infects the muscle and the nervous tissue, and then the virus hides from immune cells. And it replicates. And replicates. And as it replicates, it hijacks the cellular machinery of that 1 meter long sensory nerve axon, and it walks its way centrally toward the dorsal root ganglia at a rate of 8 to 20 millimeters per day. And that may seem like a small distance to travel, but it's about 100,000 times further than the size of the virion itself. Imagine you running at 11 miles an hour, all day long.
It's a smart virus. It gets to where it needs to go.
Eventually, the virus will get to the dorsal root ganglion, where it causes significant neuropathic pain that's perceived locally at the site of inoculation and even more diffusely across whole dermatomes. The The itchiness, or pruritus, often drives patients to scratch so vigorously so as to excoriate the skin. Following this peripheral prodromal period, central nervous system involvement becomes even more concerning. This acute neurologic phase is what kills people. 2/3 of patients with CNS involvement will manifest with encephalitis, while the other 1/3 develop a paralysis. In humans and in animals, the encephalitis can be nonspecific, mimicking just an infection or even a tumor. Patients can develop fevers, which should have already begun during the prodrome.
Aggression, unpredictable behavior.
They can have altered mental status and seizures.
They might be biting at things that aren't there. We see ataxia, disorientation, hyperesthesia. We can see muscle tremors.
However, in humans, there are some symptoms that are frequently more particular to the rabies virus. Hyperactivity, intense response to sound or light stimuli, and fever, which has become constant. And after 24 hours, consciousness begins to fluctuate. Breathing becomes spasmodic, and the patient's unable to tolerate water, and there's autonomic dysfunction. The only periods of wakefulness are characterized by extreme bouts of agitation. It's a very clever virus, actually, transmissible almost entirely through saliva.
If there is a bite, that's, an injection of saliva, so that's what we're most concerned about.
And somewhat through scratching, it seems.
Technically, people can get infected if a cat licks its paw and then scratches you.
And it may even be transmitted through the air.
There's also reports of it being spread through the air by bats in caves. There's very high levels of rabies virus in the air at some places.
But maybe the reports of airborne transmission are really just cases where the virus was acquired through saliva in an open wound, or a scratch or a bite that was asymptomatic. Whatever the vector for initial inoculation, the virus drives the next host into its own furious phase, causing them to be so aggressive as to attack others, usually with biting, and further propagate the transmission. Other classic symptoms in rabies encephalitis are the exaggerated startle response, whereby light or sound or even something as slight as the fanning of air causes the patient to jerk, with the neck flexed, face grimacing, and the breath quickly gulped. Saliva becomes intolerable, which is only made worse by the excessive production of saliva at this stage, and the patient may spit up, giving rise to the characteristic foaming at the mouth that you see in cartoon dogs. But that's not always what you see in animals with suspected rabies.
Whenever we have a cat with neurologic disease and we're not quite sure how it's progressed over time, or an animal with progressive neurologic disease, we have to take precaution and make sure rabies is on our list. Progressive neurologic signs can, sometimes start out as behavior changes. If we're seeing any kinds of seizures or ataxia, any kind of signs of central neurologic disease, then we have to think about rabies, especially if they're not vaccinated.
In humans, like I said earlier, 1/3 of patients can present with the more unusual paralytic form, which can be much trickier to identify. It can mimic Guillain-Barré, botulism, or toxic ingestion. The inspiratory spasms, which you saw in the encephalitic form of rabies, are less common, owing to diaphragmatic weakness. Progression begins from the site of inoculation. The bitten hand becomes weak, and then the trunk or the other limb muscles follow suit, eventually involving the bulbar and the respiratory muscles. Often, the persistent fever can be used to distinguish paralytic rabies from Guillain-Barré. And unlike Guillain-Barré, sensation and proprioception is typically preserved at all sites remote from the region that was bitten, and the unusual phenomenon of percussion myoedema has also been described. There's an excellent neurology video image that we posted on the blog to show this, but basically, with percussion of an affected muscle, the muscle will mound up and disappear over a matter of seconds. It's a nonspecific finding, though, and you can see it in hypothyroidism and cachexia and hyponatremia or renal failure.
In vet school, we hear all these horror stories because when we're thinking about rabies, we think about stray cats and raccoons and squirrels and things like that, and you don't really think of the larger mammals. So there are some scary horror stories out there where, vets have gone to see down cows or neurologic horses and get bit. And, they think that this is, something related to things relating to cow pregnancy or peripheral neurologic disease or something like that. And it's just not something that you think about quite commonly, but that has happened. And, vets have gotten bit, and those cows and horses have tested positive for rabies.
When I heard this from Krista, I was just imagining all the kinds of crazy horror stories that farmers pass down to their kids about things to look out for in their horses and their cattle. And then there's bat rabies, which has a different flavor from the feline and the canine versions. Neuropathic pain, which you see in the domesticated animals, is much more common among infected bats. Focal cranial neuropathies, as in Lyme disease, choreiform movements, myoclonus, and seizures are also common. But again, we're talking about bats that are symptomatic from rabies, not humans. Not that I know what myoclonus looks like in a bat, but you don't have to be out in the jungle or out in a cave to find yourself in a situation where a bat may be infected.
If you find a bat in the house and you have kids that can't report it otherwise, post-exposure vaccines are probably your safest bet. It's so serious, if they do have rabies.
Now that we've given you that pleasant image, let's talk about some of the more diagnostic aspects. In human cases, when you suspect rabies, hopefully you'll never have to, you're going to get that MRI and that lumbar puncture. Rabies preferentially affects the spinal cord, the brainstem, thalamus, and basal ganglia, although it can affect the temporal lobes and other cortical regions. Usually this means T2 prolongation, or bright flare signal abnormalities in these regions. We've posted one MRI on the blog if you really want to see something horrifying. Serum antibodies, rabies, IgM, and IgG, typically surface after 1 to 2 weeks, according to data from the CDC, and intrathecal antibody synthesis is often detected after 2 weeks. But hopefully you won't have waited that long to get the LP or to wait for that serum IgM before you begin treatment, as we'll discuss in a minute, because the symptoms rapidly worsen after the prodromal phase. All this sounds pretty bad. It gets worse. Eventually, there's circulatory collapse. Cardiac arrhythmias and systolic heart failure typically follow the coma, which, by the way, has now become permanent. And in the hours before death, spontaneous hematemesis is reported in about half the patients. So, something else to look forward to. Most human patients who die from rabies usually pass away within 1 week of developing CNS symptoms. For any of you out there who are just freaking out right now, wondering if there's a rabid rocky raccoon in your neck of the woods, let me try to dispel some fears by at least acknowledging some tips for prevention and treatment. Largely, human rabies is prevented by preventing animal rabies. Vaccinating your dog. Handling suspected infected animals appropriately.
Always wear gloves while examining them. Report any bites if they do happen to bite a technician or veterinarian.
By the 1960s, the mortality rate due to rabies among dogs and humans plummeted, and this was entirely credited to mass vaccination.
Rabies is so serious that, all those precautions while encountering wild animals are completely justified.
But sometimes you'll find yourself in a situation where an animal near you has not been vaccinated. Don't find yourself in that situation. If you see a skunk or a stray dog, don't go up and play with it. You're smarter than that. If all else fails, and you are bitten by a domestic or a wild animal, and you're unclear about their vaccination status, local wound cleaning with soap and water, not hydrogen peroxide or other caustic chemicals, not sucking of the wounds like the ancient Romans did, simple soap and water. This is helpful to prevent any superimposed infection from local skin flora. Then go to the ER. There is available post-exposure prophylaxis for rabies, which includes passive and active immunization. Passive meaning that you're infused with anti-rabies immunoglobulin antibodies, and your body has to do nothing. And active immunization meaning that you're given a rabies vaccine so that your body can actively mount its own rabies response.
As vets, we have prophylactic rabies vaccines, and we do get titered every 2 years just because of the high likelihood that we will see it every now and then or get bit. We do still have to get post-exposure boosters if we get bit by an animal that comes back, a brain sample that comes back as positive for rabies.
But for the non-vets out there, always consult with your local physician about the most up-to-date practices regarding post-exposure prophylaxis. Some people should also be considered for pre-exposure prophylaxis, as in veterinarians and people who work in animal control, like Krista said. Now what about Rocky the friendly neighborhood raccoon? Should there have been more oomph to that footnote in my neighbor's email? The latest data from the CDC reports that there are 1 to 3 cases of human rabies in the US every year for the last decade. Extraordinarily uncommon. Cases of animals are slightly more common. 60 to 70 dogs each year, and a little over 250 cats, nearly all of which were unvaccinated and were likely infected from some wild animal. And these wild animals account for more than 90% of reported cases of rabies. Bats and raccoons were the most common, accounting for 30% of all reported cases each. Skunks were next at 25%, and foxes a low 6%. Raccoons are on the downtrend as far as new incident cases, but they are the predominant rabid species along the entire East Coast, including Philadelphia. Just under 2,000 cases of rabid raccoons were reported in 2014. And this is likely a gross underestimate since we're not coon trapping or anything to get a more accurate prevalence estimate. Yeah, I said that. Coon trapping. Like what the colonials did during the American Revolution when rabies spread throughout the land of the free in little micro-pandemics. 2,000 infected raccoons a year across the East Coast. That's high enough of a number for me to actively avoid raccoons. So was my neighbor's email a bit anemic? Should it have had more substance? Yeah, it should have. That wraps it up for Brainwaves this week. If you liked what you heard, or if you didn't like it, let us know by rating the show on iTunes, Stitcher, Google Play, or wherever you get your podcasts. We're grateful to all the sponsors of the podcast over the years, now that we're coming to the conclusion of having sponsors. And this week we'd like to lastly acknowledge support from BillUp, which is a mobile app that you use to optimize your outpatient billing and ensure that your efforts in clinic result in the right insurance payment. With the app and a few clicks, you'll know if you can up your billing from a level 3 to a level 4 or 5. It's so simple and quick that it takes the thinking out of billing. BillUp, available on the App Store. The Brainwaves podcast is produced out of Philadelphia, Pennsylvania. Jim Siegler, senior producer. I'd like to give a special thanks to Dr. Krista Rieckert for her commentary on veterinary medicine. Music for this week's program was courtesy of Ars Sonor, Cold Noise, Damiano Baldoni, Kevin MacLeod, and Ghost. For additional information, you can follow us on Twitter at Brainwaves Audio, Instagram at Brainwaves Podcast, or find us on Facebook at facebook.com/brainwavesaudio. I'm Jim Siegler, and I'll talk to you again soon.
Just keep your hands to yourself with wildlife. I think that is always the safest option.